Hi, my name is Amit Como, and for my presentation today, I researched Hib. Hib stands for Haemophilus influenzae type B. It is an infectious bacterium that can cause many diseases, which some being fatal. Okay, so the nomenclature for this bacterium is Haemophilus influenzae type B. There are other types which can range from type A to type F. These are also known as the different strains that Haemophilus influenzae can take. Type B is an invasive strain, and additionally, common names include Pfeiffer's bacillus, Bacillus influenzae, and Hib. Hib is what people will refer to it most as, and Pfeiffer's bacillus is important because it acknowledges the physician, Dr. Pfeiffer, for correctly describing this bacterium in the late 19th century. So characteristics of this bacterium is it is a bacteria, not a virus. It is gram-negative. It is coccobacillus. It is non-motile. It is very small. It measures 1 micrometer by 0.3 micrometers. It is encapsulated by a polysaccharide capsule, which in part helps protect the bacteria from being susceptible to the human body and to antibiotics. It is a facultative anaerobic pathogenic bacterium, and it survives best in 37 degrees Celsius. Human beings are the only known carriers of this bacteria, and there is no reason why that is the case. The picture below, the second picture, is an image of a chocolate agar isolation technique, and that is the only medium that this bacteria can grow on. The top picture is what the bacteria looks like. So prevalence and incidence today. After the vaccine was introduced to the general public, there is practically no incidence rates for this bacteria, at least in the countries who do have the vaccine and give it to the public. So in the United States, after the vaccine was introduced, cases decreased by 99%. And Canada has a very similar incidence rate to the United States, and in other countries in Europe that use this vaccine, it has decreased by 90%. However, in certain economically developing countries, they cannot afford this vaccine, so there has been cases of Hib causing respiratory tract infections and bacterial pneumoma. And there are still populations at risk, which is why we have to give the vaccine, and it includes kids younger than 4, babies, people older than 65 with pre-existing conditions, people who are immune deficient, and certain geographical locations, which include Native Americans, African Americans, and people who live in Alaska. So those certain subpopulations, we don't know why they are really susceptible to Hib, but they just are. That is really interesting too. Okay. So historical perspective of Hib. As I stated earlier, Dr. Pfeiffer accurately described this in 1892. Nomenclature was given in 1920 of Haemophilus influenzae. However, in 1933, there is an inaccurate description based off of this nomenclature given in 1920. So as you know, it is referred to Haemophilus influenzae, which you might think that it causes the flu or is related to the flu in any sense, but it's not. It doesn't cause the flu since it's a bacteria and it doesn't cause the flu. And also, the vaccine arrived in 1988, so there was a long time before people could start being cured of this disease. because before this, a lot of young children and infants were dying from meningitis, which is one of the serious conditions that Hib causes. So with the introduction of the vaccine, the incidence rate went down a lot, which was very good. So transmission routes. Mainly this disease is passed through respiratory droplet, which can be achieved through coughing and sneezing. That is the main way that this disease will, or this bacteria will cause other diseases and conditions in your body. So once it colonizes your nasopharynx, it will enter your bloodstream and then travel to an alternate site and begin the immune response. And another way that this can happen is if you're in close encounters, if you are dealing with someone who has the Hib disease and you're talking to them and being close with them, you can catch this disease as well. So the immune response. As I just stated, the nasopharynx and the bloodstream play a very important part of triggering their immune response, but this disease will also trigger an inflammatory response. So a lot of like redness and swelling will occur with this infection. So other invasive diseases that are caused by Hib, the main one is meningitis. That is the most deadly one because it can cause bacterial infection in your brain. And the picture on top describes certain areas where conditions that can be caused by this bacteria, and the bottom picture shows which diseases are most prevalent when being caused by Hib. So meningitis is the most prevalent. So one of the pictures in the previous slide, this eye depicts otitis media, which is the skin around the eye will become inflamed and red and just look very swollen and irritated. That is very common in the Hib disease. Bacteremia is also another skin infection and inflammation that the Hib disease will cause. There are underlying conditions such as the pulmonary disease and immunodeficiency states. So there's an array of conditions that people can contract from the Hib. It just depends on a patient's susceptibility and how bad the disease is in their body. So like I said earlier, these are the at-risk populations, and so for the pre-existing conditions that can occur in older folks include sickle cell disease, asplenia, which means someone doesn't have a spleen, HIV infection, immunoglobulin deficiencies, and complement component deficiencies. So diagnosis. So practitioners and healthcare providers will usually want to run a multitude of tests. They won't just run one. So if you're getting a positive on a number of tests, that's when they'll start to suspect that you have Hib. So first they'll do a gram stain of bodily fluids and a bacterial culture of bodily fluids as well. And they'll try to detect if you have the polyribosal ribitol phosphate polysaccharide capsule, which is one of the main characteristics of Hib. And a CSF study is something that they'll want to run, which does include gram staining bacterial culture, and it looks at your protein levels in your body. A lumbar puncture is one of the main diagnostic tools that someone will run. This image depicts a lumbar puncture, just grabs your CSF fluid and just tries to see if you have any bacterial infection. And imaging techniques, they'll try to take images of your body that might be infected by Hib. So prevention methods. So these methods include vaccine and antibiotics. Those are the most primary, and there are others which include alternative methods and glucocorticoids and surgery methods. Surgery methods will mainly deal with the drainage of certain parts of the body. Glucocorticoids are only used in immunodeficient patients and usually young kids. Antibiotics, there is a range of antibiotics that you can use. It can be second generation or third generation, and it all just depends on how susceptible a patient is, and it can be inpatient and outpatient. And usually they'll try to administer antibiotics for 10 days. Alternative methods can be given depending on someone's susceptibility. Once again, breathing support is used for respiratory tract infections, and wound care is usually used for skin inflammation and infections. So vaccines, you can have a vaccine that just treats Hib, and you can have a vaccine that treats Hibs and other diseases like tetanus, whooping cough, polio. But primarily the vaccine is a third generation cephalosporin, and they'll use that until they can use an antibiotic to kind of treat the body. So this was my report on the Hib disease. Thanks for watching.